In every doctor's practice, there are cases that stay with you for a lifetime, not because of their complexity or a rare diagnosis, but because they change your perspective on medicine itself. For Dr. Alan Evans, a general practitioner with 20 years of experience, that case was the story of Anna and her ghostly pains. Anna first came to him on a gloomy October morning, a young woman, about 30, with a quiet, almost apologetic voice. Her complaint was strange. Every few days, she would experience a sharp, stabbing pain in her left shoulder. It would appear suddenly, last for 10 minutes to an hour, and then just as suddenly vanish, leaving no trace. Dr. Evans did what he was supposed to do. He ordered a full workup, an X-ray of the shoulder joint, an MRI, blood tests for inflammatory markers, a consultation with a neurologist. The results came back one by one, and each bore the same note: no abnormalities detected. The shoulder was perfectly healthy, the nerves were fine, there was no hint of inflammation in her blood, but the pain was there. Anna described it so vividly and precisely that it was impossible to doubt its reality. Dr. Evans' colleagues just shrugged. Maybe she's faking it, one suggested, or just hypochondria, said another. But Dr. Evans was known for being a good listener, and he saw not cunning in Anna's eyes, but sincere suffering and fear, a fear of the unknown that was perhaps even more potent than the pain itself. A month went by. The doctor rechecked all the tests. A dead end. And so he decided to take a different approach. At their next appointment, he set aside the stack of test results and looked directly at Anna. "Anna," he said softly, "we've been looking for what is hurting you. Let's try to understand when it hurts. I want to ask you to do one thing. Keep a journal. Not a medical one, just a regular one. Write down everything. What you ate, who you talked to, what you thought about, what you felt, and mark every time the pain occurs." Anna looked at him doubtfully, but she agreed. 2 weeks later, she returned. In her hands was a slim notebook. Dr. Evans opened it. The first few pages were chaotic: breakfast, work, call with mom, pain, met a friend, saw a movie, everything's fine. But then Evans began to notice a pattern. A pain attack had occurred an hour before Anna had to give a presentation at work. Another came in the evening, after a difficult conversation with her sister. A third happened on a Sunday, as she was thinking about the upcoming work week. The pain wasn't linked to physical exertion. It was linked to anxiety, to stress. Dr. Evans looked up at Anna. "Anna, tell me, do you consider yourself an anxious person?" She froze for a moment, then gave a slight, quiet nod. I've always been this way. I worry about everything. I'm afraid of letting people down, afraid of not being good enough. But I try not to show it, to keep it all inside." And in that moment, the puzzle fell into place. "Your pain is real, Anna," the doctor said. "Your body isn't lying, but the source of this pain isn't in your shoulder. Imagine our mind is a pressure cooker. When we suppress strong emotions, especially fear and anxiety, the pressure builds, and sooner or later it has to find an outlet. For some, it leads to panic attacks. For others, stomach problems. For you, your body has chosen this way to signal that it's overloaded. It's using physical pain as an emergency release valve. This is called a somatoform disorder. Your body is literally screaming about the stress that your mind is trying to ignore." Silence filled the room. For the first time in months, the fear in Anna's eyes was replaced by understanding. She wasn't just given a name for her illness, she was given its story. This wasn't the end of her treatment, but only the beginning. Dr. Evans referred Anna to a good psychotherapist. They began to work on her anxiety, learning relaxation techniques. The pains didn't disappear overnight, but now when they came, Anna knew they weren't a ghost. They were a signal to stop, breathe, and ask herself, what am I really anxious about right now? 6 months later, the attacks became rare and almost unnoticeable. Dr. Evans often recalled the story when new patients came to him with unexplainable symptoms, and he understood that sometimes the most important part of a doctor's job isn't to decipher a lab result, but to hear the story that a person doesn't dare to tell even themselves, a story written in the language of the body.